Okay, bonjour everyone. My name is Jennifer Lorette, and this video is going to be about acid reflux, gastroesophageal reflux disease, GERD, heartburn. Here we go. These are the notes for this video on this page. Okay, so in this video, we're going to start with what is GERD, and then we're going to move on to the common causes, then the common symptoms, discuss the difference between GERD versus an ulcer, because they kind of feel the same, but they're very different. Complications, long-term complications, and then finally, we're going to talk about what you can do to fix this. So please, I hope you enjoy this video, and if you do, give it a thumbs up. Okay, so first let's say, what is GERD? G-E-R-D, gastroesophageal reflux disease is what it stands for, also known as acid reflux, heartburn, the coughs, the chest pain. People love to say that it's chest pain, but it's not really, I mean, it's located in your chest, but it's not the emergent chest pain such as your heart having a heart attack, but it feels the same. It feels awful. So basically what happens is you have a band of muscle, right? It's a little band of muscle like this that is at everywhere that you kind of have an opening in your body. So it is in your esophagus, at the top, at the bottom, it's after your stomach, it's even at your anus, right? So that you can expel everything that you ate that day. So that band of tissue is supposed to stay closed, unless if you are eating, right? Passing something through, or sometimes it becomes irritated, and that's what happens with GERD. So if you are somebody who has GERD at least once a week, then you should watch this video completely, because this is your free doctor's visit. And with this doctor visit, it's not ending in a prescription, because thumbs down to drugs. There's always a way. There's always so many steps before drugs. You know what GERD is now? Now let's say versus an ulcer, right? So the location matters. You can develop these symptoms and ulcers in your esophagus, or your stomach, or even your duodenum, which is after your stomach. It's the first part of your bowels, right? And when the pain matters helps you distinguish whether or not it's an ulcer or whether it's GERD. So if the pain happens with food, like while you're actively eating, then it probably isn't GERD, it might be an ulcer, because what's happening in an ulcer in your stomach, because what's happening is as the acid is being built up, it's irritating your stomach more. If it happens after you eat, then it may be an ulcer somewhere else, or it may be GERD. Okay, now what are the causes of GERD? Some of these are a little controversial, some of these are gonna upset you, but we need to discuss them. The very first one is snacking. Now, GERD is linked to, is common in people with increased BMI. Now, is it the fact that you are eating too much that causes your BMI to increase and then causes GERD? Or is it the actual eating process and snacking that causes GERD? Now, I think that it's the actual snacking, because what happens is you have large meals, you have small meals, right? Acid is produced depending on how much you're eating. So if you're eating large meals, you're going to produce way more acid. So if you're eating frequently large meals all day long, your stomach is just like a ball of acid. If you're eating small meals in between those large meals and your stomach's like, oh my God, is this a large meal? Let me just attack it because we're so used to large meals. But really this is a small meal, so now there's excess acid, and thus you have irritation and GERD. So snacking, number one. Next is alcohol. I think that's pretty self-explanatory. Just think about the pH of alcohol, think about the pH of your stomach. It's just a little bit too much. It's a little too much acid going on. So just everything in moderation, which we'll talk about later. Another common trigger is stress, right? Stress is a huge culprit. We see this one with babies. So eating and then laying flat. Why do babies develop acid reflux? Because when they eat, it's supposed to sit like this, and then you lay flat and you become parallel like this. So what is supposed to just go straight down, is now going back up, and it's regurgitating back up through your esophagus and trying to come out of your mouth. So do not lay down immediately after eating. That worsens your GERD completely. That is a major trigger, major trigger, and we see it in babies. Another thing is flat sleeping. So if you sleep flat, again, overnight, your body is still working, right? Your stomach is still producing acid. It's still working. Laying flat, the food will come back up, regurgitate. Pregnancy is another cause because you have more mass, so you're squishing more organs. The baby's squishing certain organs, which can cause you to regurgitate as well. This one is a trigger for me. Tight clothing, and especially anything that goes right here. So bras, specifically ladies, or tight little crop tops, anything that is tight right here in this area. It happens to me anytime I wear something tight and it's like, yowza, that hurts. Another thing is anything that can make your sphincter harden, such as cancer, right? Cancer can cause GERD as well. Coffee is another one that's self-explanatory. Think of alcohol, think of coffee, the pH, plus your stomach's pH, like it's just way too much acid going on. It's just a lot. Another thing, wow, ladies, I didn't realize that this gave me a little bit of GERD too. On my monthly, I take NSAIDs, right? I take things like ibuprofen. Ibuprofen can cause worsening GERD or even give you GERD, because what it does is it blocks this beautiful thing called prostaglandins, which keeps the stomach, keeps everything happy, keeps everything like kind of more balanced. It blocks that. So all you have is a ball of fire, ball of acid. So NSAIDs, ladies, pay attention to when you're getting the GERD. If it's after you just took some pills because you're on your monthly cycle, then you just need to cut back, or take it with a lot of food, something to balance out the pH in your stomach, like food or milk or something basic. This one's well known, spicy foods, fatty foods, because spicy is lower pH, and then fatty foods they don't really sit well. They call it, like, fat wants to rise because it's very light. So those two things cause it as well. Another thing that can cause GERD is straining. So straining, like when you're going to the bathroom, it can cause your sphincter in your esophagus to weaken, as well as the sphincter in your anal canal to weaken. That's why people get hemorrhoids when they strain or they have prolonged constipation. Okay, long-term complications. For most people, some people can develop asthma, again, because they're so close together. Your windpipe and your food pipe are so close together. You can develop asthma, worsening or new, a chronic cough, and unfortunately cancer. The reason why you can develop cancer is because your cells are trying to heal all day long at a rapid pace. So eventually some cells are going to get a little wonky and become cancerous. That's what happens with anything that you cause your body to overheal and to keep healing. It can cause cancer. That's why smoking, they say, can cause this, because smoking bothers your windpipe every time you smoke. So the more you bother it, the more it has to heal. So now let's talk about the common symptoms, right? The signs and symptoms. Some people develop like sour taste in their mouth after they wake up, or when they wake up. After they eat, sometimes you can taste a little bit of sour. Difficulty swallowing. It's going to start with liquids first before it ever comes to difficulty swallowing solids. So if you're ever like it's a little hard to swallow and you're also getting those chest pains, chances are you have a little bit of acid reflux. Chest pain, frequent chest pain right here, that's not related to your heart. I mean, you can kind of feel the difference. You can, because acid pain is very different than a heart attack pain. Another symptom is a cough, chronic cough. People develop that, as well as pain with speaking. Remember, your voice box, your larynx, all of those areas are connected. So you can have some issues. I should go back to the cough. The reason why you have issues with cough is because, okay, so let's talk about cough a little bit more. Why is it causing you to cough? Why is it irritating your windpipe if it's food related? So look at these two pens here, right? The black pen is going to be your windpipe, and then the other pen is going to be your esophagus. This is how it is in your anatomy, stuck. So anything that happens to one will affect the other. So smoking will affect your esophagus, even though it's going down your windpipe, okay? And then food, acid, will affect your windpipe, even though that's only happening in your food pipe. And lastly, I just want to leave you with what to do. Like, if you're having an attack, immediately sit up. Like, if you're laying flat and you're having an attack, stop laying flat. Like, you immediately have to sit up, and you immediately have to drink some nice, cool, refreshing water. A nice glass of water, and even better, a nice glass of milk or something pH balanced like that. Don't do anything that has any more acidic in. Don't stay away from the lemons, the oranges, all of that stuff during an attack. So sit up straight and drink something cool and relax. Okay, Jenny, so, you just told me that I have GERD. You explained it to me so beautifully. Now, what do I do about it? Let's talk about what you do. Meds. Boo. Thumbs down. 20,000 thumbs down for medication. Listen to these first before you do medication. And if these don't help you, then okay, let's talk about meds, which we will. Sleep higher. That's the first one. This is what I think everybody should do that has some GERD. Sleep higher. Instead of sleeping flat, let's just sleep at an angle. You know, sleep with your head, sleep at an angle as opposed to completely flat. Just put your head a little higher. Get multiple pillows and make sure you prop yourself up so that everything that's going down stays down. Nothing ever comes back up. Because the reason with GERD, what's happening is that your sphincter, that thing that's supposed to stay closed, it's just weak. So it opens up more often than it should. And it will do that while you're sleeping. And most people sleep flat. So if it's opening while you're sleeping and you're flat, straight up to your... Okay, the second thing is to avoid the triggers. Obviously, avoid those triggers, guys. Now, I'm not telling you to never drink ever again, to never have stress ever again, but everything in moderation. And if you're trying to cut back on any of these triggers, just cut it in half. If you have 10 cups of coffee a day, let's go down to 5. If you have 10 cigarettes a day, let's go down to 5. Everything in moderation and try to cut back. The best way to cut back is to cut in half. Another tip would be to eat slower, right? So that your body can have time to adjust to the, okay, that's a little bit more food, let's do a little bit more acid. Okay, that's a little less food, let's not acid, as opposed to a whole bunch of food that just makes the acid keep going, right? So eat less food and eat less acidic foods. So stay away from the lemons, the ketchups, everything that has pizza sauces, all of that, let's do in moderation. You don't have to eliminate it, just moderation. Okay, now for the meds. A med that, well, everybody knows Tums, right? You can take them, sure, but temporary fixes. Another med that's a temporary fix that I kind of like, that I actually use personally, is something called Tagamet. And I like it because it's fast acting and it does the job, and it does the job well. You don't need to take it that often if you're somebody who just gets minor attacks every now and then. So Tagamet, really well. Another remedy would be like calming teas, such as chamomile. Chamomile is delicious. It's amazing. I don't know about minty tea. There's a lot of controversy. The studies show that minty tea makes it worse, but then my mom says that it makes hers better. Okay, that's all for this video, and I hope that you enjoyed it. Thank you so much for watching. And if you like videos like this, where I'm giving medical knowledge and breaking things down the way that I do, please comment down below the ones that you want to see. Like this video so that I know that I'm headed in the right direction and this is content that you are enjoying. As always, peace and abundance, and find me on social media if you want to stay engaged with me and my life and what I do. Peace for now.